Hello and welcome to my dissertation proposal, Designing a Health Coach Augmented mHealth System for Secondary Prevention of Coronary Heart Disease. I am Avijit Sengupta, a PhD candidate at the Moma College of Business, University of South Florida. Chronic diseases are leading causes of death and disability in not only the United States of America, but all over the world. It affects 6 out of 10 adults in the United States. Chronic diseases cost the nation 90% of its $3.5 trillion of annual healthcare cost. Among all the chronic diseases, heart disease is the most prevalent chronic disease. Heart diseases are responsible for 1 in every 4 deaths. Coronary heart disease is the most common heart disease. It afflicts 18.2 million people in the United States. According to the most recent circulation of American Heart Association, coronary heart disease is responsible for killing over 365,000 people in 2017. Estimated cost of curing coronary heart disease was 182 billion of US dollars in 2015. Center-based cardiac rehabilitation programs are the gold standard of care for the secondary prevention of coronary heart disease. Center-based cardiac rehabilitation in the United States generally takes place in the outpatient setting over 12 weeks, after which patients are encouraged to attend ongoing community-based exercise programs. Those center-based cardiac rehabilitation programs are still considered as the gold standard of care for the secondary prevention of coronary heart disease. Inadequate health insurance, low family income, transportation challenges, time constraints, and work-related obligations deter patients from attending center-based cardiac rehabilitation. However, ubiquitous nature of smartphone-based technology offers the opportunity for the design and development of a personalized home-based cardiac rehabilitation system. Home-based cardiac rehabilitation compared to center-based cardiac rehabilitation overcomes logistic barriers to access, including the limited 3 to 4 hours weekly in-person contact with healthcare staff, and is less costly. It can provide health-related education, real-time feedback, and continuous monitoring through wearable sensors and smartphones that are available 24/7. Considering the possibilities of home-based cardiac rehabilitation, we formulated 3 research questions. Number 1. What is feasible and required to develop a comprehensive mHealth home-based cardiac rehabilitation system for patients with coronary heart disease? What is the effect of automated, theory-based behavior change intervention messages on coronary heart disease patients' daily physical activities? The third one, what is the effect of health coach augmented customized behavior change intervention messages on coronary heart disease patients' daily physical activities? To address our research questions, we developed a high-fidelity prototype of a home-based cardiac rehabilitation system which consists of a wrist-owned smartwatch, a smartphone application, and a web-based dashboard for monitoring user-generated data. By deploying our prototype in real-world field environment, we check the efficacy of 2 different types of intervention messages. The first type of intervention messages are pre-programmed and triggered automatically based on users' goal performance status. The second type of intervention messages are sent by the health coach based on the individual user's overall performance and lapses. We conducted a single group quasi experiment where 8 coronary heart disease patients used our home-based cardiac rehabilitation system for 91 days. During that time, we collected raw census data, user app usage related data, survey data, and semi-structured interview data. Our preliminary analysis of data suggests that pre-programmed intervention messages have a significant positive impact on patients' physical activity measured through daily step count, daily walking duration, and daily distance covered on the same day. We also found pre-programmed intervention messages also has a significant positive impact on patients' physical activity on the next day. Besides, our preliminary analysis also suggests a positive impact of pre-programmed intervention messages on the patient's next day daily walking goal set. However, we did not find any significant impact of customized text-based intervention messages on the physical activity performance of patients. Regarding contribution, we developed 3 novel artifacts to support a home-based cardiac rehabilitation program: a customized activity direction algorithm, a mobile app, a web-based dashboard capable of creating unique visualizations. We developed the process of creating meaningful graphical user interface of interventions. Finally, our designed artifact helped patients to connect back to the clinical care. Our advanced prototype is currently going through a randomized control trial. Thank you for your time.